Hi everybody, it's Dr. Levi, the Gamers and Esports Doctor, here at Horsepower CrossFit Gym in Los Angeles. And today we're talking about CPR. CPR on a child or an infant. And it's very important that you know the differences because the anatomy of a child and or infant is very different from an adult. So today we're going to be talking to Rescue Pro CPR professional, Mr. Sean Thomas, about this type of CPR for a young infant. So get ready to learn a lot. Come on in, Sean.
Thank you.
So why is it important for someone to learn this type of CPR on the child versus an adult?
The CPR for a child and adult, there is differences. The overall techniques that you use, what you're trying to accomplish is the same thing. You just want to go about it a little bit differently. And
yes.
If you're not familiar, it can be a little overwhelming.
Got it. Teach us. We're ready.
Okay, so you want to do the same things when you come across a child or you have a baby that is not responsive and you're not sure. You want to check and see if they're awake or if they're just sleeping. And instead of an adult where you shake them and you do that, with a baby, what you're going to do is you're going to agitate on the lower feet. You're going to tap their feet, you're going to pinch, you're going to tickle, you're going to do something on their extremities
yes.
to try and get them to do something different.
Got it.
That's
to be awake, basically.
Yeah, that's going to be different.
Got it.
After that doesn't work, you're going to send somebody to call 911 specifically.
Specifically tell that person you call 911.
Exactly.
Okay.
And then you go back to the baby and you need to check the pulse.
Got it.
So it's very difficult to find a pulse on a baby up in the neck. So we're going to look right under the arm, right under the bicep.
Yes.
This is where you're going to check for a baby.
So you go into the axilla, basically.
Yeah. You go under the bicep.
Yes.
You go in and up.
Got
and you'll
it.
be able to find, it's called the brachial pulse. So you're going to go in and out there and you're going to check to see if a pulse there. If
right.
you don't find a pulse, then you need to do compressions. But instead of doing compressions on an adult where we did it like this,
yes.
chest is a little bit smaller, so you're just going to use 2 fingers right in the center of the chest.
So right above the sternum or right on the sternum?
Roughly the same spot, but you're not going to use your whole hand. You can just use 2 fingers, or if there's more than one of you, you can use the 2 thumb technique and go like that.
Okay, great. So I want to learn.
Sure.
So again,
if there's 2 of you, you're going to do this.
So I don't move the neck or head or anything.
No, you
like
don't
that.
want to. You don't want to move the neck up and down because that will close off the airway. So you want to leave it in a nice neutral.
Got it. So around the thorax, the chest cavity, 2 thumbs right above.
2 thumbs.
Do I bend my thumbs here, or I keep them just straight to push down like that?
Whatever you're going to be able to do the longest.
Okay, because when we game, we game like this.
Yeah.
So I like to do that with my thumb.
And you can hear that click.
Yeah, so I want to hear that.
1.5 inches.
Okay, how many compressions?
You're going to do, if you're going to do 15 of them.
15
and then
here.
Your partner who's up here is going to do 2 compressions.
So
two breaths.
2 breaths.
2 rests.
So again, for an adult, if it were an adult, it's going to be 30 compressions and 2 breaths. For a child, it's going to be 15 compressions and then 2 breaths. Now, I'd like you to teach us this. How do you hold or position the neck and the cervical spine of the child when you're giving the breaths?
Okay, so for a baby like this, if you have something that's hard and rigid like this,
hard
or the
surface.
floor, a hard surface,
yes.
you can leave them on here. You can leave them on the table, and then you can just position the neck so that it is neutral. You don't want to bend.
So you don't want to hyperextend.
You don't want it. You want to leave it in there. And when you breathe into it, you're going to take the nose and mouth at the same time.
So you literally take your mouth over their nose and over their mouth and breathe in.
Yeah, they got a small face up there. You're going to be able to get your whole mouth around.
And again, 15 compressions, 2 breaths.
Correct.
Got it. Well, I think it's so important that we know how to do this properly for a child and or infant. Thanks for sharing this with us, Sean. Anything else you're thinking that we should know? Any other closing thoughts?
No, just if you get into a situation like this, the most important thing is don't panic, just try to do something.
Makes sense. Well, you heard it from the professional here, Sean Thomas. Thanks a lot for being with us, Sean. Please practice this and learn the basics. And if you want a really in-depth knowledge about this, I definitely say reach out to Sean Thomas. His company, Rescue Pro CPR. He's available. He has a lot of knowledge. He did CPR training in my office in Glendale. So he's a great guy and someone who could definitely help you and your company from a church to a gym to a medical practice. He's available and he's the best. So thank you, Sean.
Thank you very much.
All right. See you guys later.